So you go to the doctor and the doctor writes you a script. Maybe it's for some condition you have, whether it's diabetes or blood pressure or a risk of a heart attack or cholesterol or whatever it is. The doctor's written you a script. But here's the question. What percentage of people who get the same script that you just got are actually helped by this medication? You would hope all of them, wouldn't you? Well, think again, because the reality is far different. You see, here's a term that I only just discovered recently, NNT. Those letters stand for the number needed to treat. In other words, the number of people who will take this medication in order for just one person to be actually helped by the medication. You see, if that number is one person gets the meds and one person is helped, that's fantastic, but that's not the reality. What if it's more like this? That 300 people take that medication and only one of them is actually helped by those meds. That's the number needed to treat. Now, corresponding to this NNT is the term NNH. That stands for the number needed to harm. You would be well aware that nearly all medications have side effects, and sometimes these side effects can be quite serious. And so we have this term NNH, the number needed to harm, to give us an indication of what the risk level is of experiencing some fairly serious side effects to your medication. Let's take the most commonly prescribed drug on the market today, and that is statins, a massive multi-billion-dollar a year market peddled by Big Pharma. They claim it's going to lower your cholesterol and therefore lower your risk of a heart attack. We've bought that line for generations. So let me ask you this question. What is the NNT for statins? What is the number needed to treat for statins? That means the number of people that would have to take a statin in order for just one person to be actually helped by the statin. Well, it depends on your risk factor. It might be this situation, that your LDL is a bit high. The doctor says your LDL is high. We're going to put you on a statin, where all of your other blood markers are fine. You've got no CAC score to speak of. You've got no real family history to speak of, or you've got LDL. Then the number needed to treat in that scenario is 1 in 300. That means 300 people would have to be taking the tablet in order to help just one. By help, we mean defer a heart attack within a 5-year period. But then, what if you're in a midterm risk group? The people in this group are people that have never had a heart issue or a heart attack, but maybe experiencing a high CAC score, or maybe you've got high blood pressure, or you're a certain age group, or you've got a strong family history. The people in this group, their NNT is 60 to 100. That means there's still somewhere between 60 and 100 people that have got to take this drug before even one of them is helped. But you could go all the way to a high-risk group, a very high-risk group. These are the people that have actually had a heart attack and they don't want to have a second one. In this case, the number needed to treat might be as low as 30. And in that scenario, yes, it might be wise to go onto that tablet. But you see, you need to know these things. You also need to know, along with your NNT, you need to know the number needed to harm. With statins, there are many side effects, and these are rarely discussed by doctors, but they know them. Statins are the most studied drug in history because they're so common. We know all about them. The number needed to harm for a statin is just 30. This means that maybe your LDL is up a bit and you've been given a statin by your doctor. In that case scenario, you are 15 times more likely to get a serious side effect from the statin than you are to be helped by it. You see, This does not mean I'm not telling you you shouldn't be taking these meds, but you need to know these numbers and your doctor should know them. So ask your doctor when you go to see your doctor, there's a script on the table, ask them what is the benefit and what is the risk. What's the NNT and what's the NNH? Your doctor should know those things. Let me tell you about my own situation. A couple of years ago, I went to the doctor and the doctor said to me, "You've got very high blood pressure." It was about 190 over whatever it was. And so it was quite high. And so I was given a drug called Statin here in Australia anyway. And it was designed to lower your blood pressure. But the problem was it didn't work. So I went back after 3 months and the doctor simply increased the dose. Well, it still didn't work. And then I went back after another 3 months and the doctor added a diuretic and said this should do the trick. But again, it didn't work. So I had been on medication for 1 year with no impact at all. I was concerned about that because I expected that if the doctor gave me a tablet, that the tablet would help. But what we're saying here is that I also needed the number needed to treat, because that number is a long way from 1. So what does blood pressure medication actually do? What's it designed to do? It's designed to help block some of your blood pressure pathways. And a diuretic is designed to push water out of your system. But in my case, all these medications were doing were fighting symptoms, and it was a losing battle because there was a root cause somewhere else that was causing the high blood pressure. For me, my high blood pressure was caused by poor metabolic health, by a high insulin reading, and also high levels of inflammation in my body. So by taking a medication for blood pressure, all I was doing was treating symptoms and not the root cause. It's a little bit like being out in a canoe, which I do often, and imagine your canoe has got a hole in it, and so you're bailing water out of the boat. Well, the bailing water out of the boat is treating the symptoms. You'd be much better off to treat the root cause and to block up the hole. And this is what the medication in my particular situation did not do. All it did was to treat the symptoms, but the hole was getting bigger and bigger, and so more and more water was getting into my boat. So after 12 months of medication and not getting better but only getting worse, I decided to do some research myself and to take responsibility for my own health. That's the best thing I think anybody can do. And out of that research and inquiry and reading and study, I found the carnivore diet and I started the carnivore diet. And do you know what? Within 1 month of being on the carnivore diet, my blood pressure dropped to normal and it stayed there ever since. You see, what did carnivore do for me? Well, it cut sugar. It cut grains out of my diet, and it cut seed oils out of my diet. As a result of those 3 things, my insulin level dropped. I've seen that on a blood test now. My inflammation markers have all dropped, and I lost weight. Now, the culmination of those 3 things is that my blood pressure dropped. You see, here was the root cause, not a symptom. So I treated the root cause and my symptoms went away and I got off the medication. So if you're on medications, I'm certainly not telling you to drop your medications. I'm not a doctor and that's not my job to do that. But I am asking you, if you're on medications, ask yourself, are they working? Are they doing what they were designed to do? Are you confident that they are helping you? Have a conversation with your doctor when you get a prescription for any sort of medication. Ask them about the benefits and ask them about the risks. Ask them what the NNT is and what the NNH is. Ask them so that you are well informed and you are best equipped to make the decision over whether you want to take this medication or not. Remember, it's always your choice. You don't work for the doctor works for you. The doctor is a consultant, so use them as such and ask the right questions and make sure you're getting the right answers. You know, when you take time to treat the root cause, things really begin to change. And for me, that was as simple as changing what was on my plate when I had my meal. please join our Facebook group, the Carnivore Pensioner, and consider joining our channel. Members get a number of benefits. They get videos earlier than anyone else, and they get a members only video every couple of weeks. But anyway, I will see you on the next video, and until then, you might like to watch this video up here, and I will see you on the next video. Bye for now. Keep telling your story.